Case study presentation Delusional Disorder Mixed Type by Julian Aumile, DNP, AGMP, CRNP, RN, University of Texas, Rio Grande Valley, Nursing 6261-91L, Summer 2, 2020. Dr. Nadia T.S., August 11, 2020. Case Study 1, History. Aisuke Daishi, a 23-year-old engineering student from Japan, referred to his university student mental health clinic by a professor. Professor is concerned about his irregular school attendance. Presenting symptoms. Mr. Aisuke Daishi problems began 3 months earlier after he returned from a visit to Japan. Believed that his classmates sneezed and grinned in an odd way when he entered the classroom. Distracted by the listening devices and thought control machines that had been placed in his apartment. Relieved to have a chance to talk in a room that had not yet been bugged. Concerned about 2 strangers outside his apartment when returning from class. Believed about his apartment being bugged about a week after seeing the strangers outside his apartment. Believed reporters commented indirectly and critically about him when watched television, especially Fox News. Believed to be targeted because of his superior intelligence and his intention to someday become the Prime Minister of Japan. Presenting symptoms continued. Believed that Fox News was trying to make him go mad by instilling conservative ideas into his brain, which was possible through the use of tiny mind control devices installed in his apartment. Irregular sleep as a result of hyper-vigilant thinking that everyone in the school were plotting against him. Withdrawn and absence from class attendance. Eat healthy and still maintain his personal hygiene. Denied feeling elation or euphoria. Normal level of energy and clear thinking. Diagnosis criteria. Delusional disorder, mixed type. Delusions are false beliefs not in alignment with the culture. They are very challenging to treat and among the most common symptoms exhibited by mentally ill patients. Delusional disorder can be diagnosed when a person shows non-bizarre delusions of at least 1 month's duration, which is not attributed to other psychiatric disorders. Diagnosis criteria. Mr. Aisuke Daishi delusional disorder might be precipitated by substance use, in this case, smoking of pot during his trip to Japan. Mr. Daishi was diagnosed with mixed delusional disorder because he has exhibited more than 1 delusional disorder for over a month period, and in this case, 3 months. Delusional disorder in case study 1 include persecutory delusion, delusions of reference, thought insertion, and grandeur delusion. Differential diagnosis. Schizophreniform disorder or schizophrenia because of bizarre delusion of thought insertion. Other psychotic conditions, in this case, a 3-month duration of symptoms is considered too long for a brief psychosis because for a diagnosis of brief psychosis to be definite, the symptoms shouldn't be longer than 1 month. Schizophrenia. Symptoms were short because of the diagnosis of schizophrenia to be definite, the symptoms should last for up to 6 months. Differential diagnosis here should be appropriate for schizophreniform disorder, in which symptoms are expected to persist between 1 to 6 months duration, but he is not having second symptoms such as hallucinations, negative symptoms, and disorganizations, which are also required for the diagnosis of schizophreniform disorder to be made. There is absence of mania and depression. It excludes the diagnosis of bipolar disorder, major depressive disorder, with or without other psychotic features, and schizoaffective disorder. Epidemiology. In the United States, the prevalence of the delusional disorder is currently estimated to be 0.2 to 0.3%. The annual incidence of delusional disorder is 1 to 3 new cases per 100,000 persons. Delusional disorder mean age of onset is estimated to be around 40 years, but the range for age of onset runs from 18 years of age to the 90s. As with all major psychiatric disorders, the cause of delusional disorder is unknown. The central concept about the cause of delusional disorder is its distinctness from schizophrenia and the mood disorders. The most remarkable feature of patients with delusional disorder is that the mental status examination shows them to be quite normal. There are many types of delusional disorder, but the predominant type can be specified at the time of diagnosis. Significance. Delusional disorder may be underreported because delusional patients rarely seek psychiatric help unless forced by their families or courts. Men are more likely to develop paranoid delusions than women, who are more likely to develop delusions of erotomania. Patients currently classified as having delusional disorder probably have a heterogeneous group of conditions with delusions as the predominant symptom. The most common type of delusion reported in descriptive studies is persecution, 58% to 64%, followed by infidelity. Persistent delusional disorder has been found to have significant comorbidity with affective disorders, depression in particular being the most common. The implication to nursing practice. Delusional beliefs are key symptoms of mental illness, and they rarely occur in isolation. Delusions are a core feature of schizophrenia, occurring in around 70%, most commonly with concomitant hallucinations and grouped as positive symptoms. Within psychosis, delusions usually are seen as one of many symptoms, including hallucinations, disordered thinking, cognitive challenges, and changes in mood. Whereas clinical variables have good prognostic accuracy for ruling out individuals who will not develop psychosis, there is a need to improve the prediction accuracy of future transition to psychosis. Treatment of delusional disorder. Delusional disorder is considered difficult to treat. Antipsychotic drugs, antidepressants, and mood-stabilizing medications are frequently used to treat delusional disorder. There is also a growing interest in psychological therapy such as psychotherapy and cognitive behavioral therapy as means of treatment. Prognosis of delusional disorder. Treating patients with delusional disorder can be very challenging. Clinicians should ensure compliance with treatment regimen and retain them for a long-term follow-up. Prognosis of delusional disorder is good with adherence to treatment regimen. References: American Psychiatric Association, 2013, Diagnostic and Statistical Manual on Mental Health Disorder, DSM-5, 5th edition, Washington, D.C., American Psychiatric Publishing. Diakonesu Ohako, DJ Bogowati, 2019, Models of Persecutory Delusions, A Mechanistic Insight to the Early Stages of Psychosis, Molecular Psychiatry, 24, 1258 to 1267. Jalali R.M., Sean J., and Manchowski T.C., 2015, Current Treatments for Delusional Disorder, Current Treatment Options in Psychiatry, 2, page 151 to 167. References continued. Picardi A., Fonzi L., Palagrossi M., Gigantesco A., and Biondi M., 2018. Delusional Themes Across Affective and Non-Affective Psychosis. Retrieved from http://www.frontierscene.org/ /articles/10.3389/FPSYT 2018 full desk. SADOC BJ, SADOC VA, and Rules P 2015 Kaplan and SADOC Synopsis of Psychiatry, Behavioral Science/Clinical Psychiatry 11th edition, Philadelphia, PA, Waters, Glowell. Skelton M. Loka WA, and Thacker SP 2015 Treatments of Delusional Disorder, Cochrane Database of Systematic Review 5. References continued. Ulrich S., KSR, Shaw J., Doe M., Coy J. W. 2018 Acting on Delusions, the Role of Negative Affect in the Pathway Towards Serious Violence, the Journal of Forensic Psychiatry and Psychology, 29-5-691-704. Upgrove R. 2018 Delusional Beliefs in the Clinical Context, retrieved from https://link-springer.com/chapter/10.1007/978-3-319-97202-2-1.